the awareness is very low and the incidence of complication is sometimes higher than we perceive. We actually saw that about 30% of the patient population who had tongue and lip piercing showed gum recession or periodontal issues around their teeth, and the same number is for tooth cracks and broken teeth. So from one side we have a very low awareness, and from the other side we have a higher rate of complications. And those are just the usual complications. Actually, when we compare that to a group that had no piercing, they had about 10% of gum recession. So when we were calculating that statistically, it showed that people with piercing has 7.5 higher chances to have those gum complications, which is a very high number at that young age, because we're talking about a patient population of the age of around 18.
Definitely don't cheap out. You do get what you pay for. So if you're paying more or less on like the $100 scale, you should be fine. Just make sure the place is also sterile, just so you don't get any infections or diseases even during the healing process. Really listen to what they tell you not to ingest, because that affects the healing process and also taking care of it.
15 years old, I decided I needed a lip ring. Spent about a year convincing my parents. At 16, they finally buckled, let me get one. And about a year later, I chipped my front tooth right there on my lip ring during an exam. Frankly, I was more concerned about being cool at 16 than about keeping my teeth healthy. I tell people that if you want it done, I mean, nobody can really say one way or the other, but you need to be careful. You need to take care of your teeth. And really, more than anything, I think you need to watch for the receding gums, because you can't fix that. You can cosmetically fix a chip. You cannot fix receding gums.